Good morning to all. Myself T. Prabhu, Assistant Professor, SNS College of Pharmacy and Health Science, Coimbatore. Today we are discuss about case study of Myasthenia gravis. Uh, it is a chronic autoimmune disorder that causes muscle weakness, particularly in muscles that control eye movements, facial expression, chewing, swallowing, and speaking. First one is it is an autoimmune nature. The myasthenia gravis occurs when the immune system mistakenly attacks by the neuromuscular junctions, that areas where nerve impulse that transmitted to muscles. These attacks impairs the communication between nerves and muscles, leading to muscle weakness and fatigue. Next, what are the symptoms of myasthenia gravis? The symptoms of hallmarks of myasthenia gravis include in muscle weakness that worsen with activity, improves with rest, like dropping of one or both eyelids, ptosis, double vision, diplopia, difficulty in speaking clearly, difficulty in chewing and swallowing, weakness in the arms, hands, fingers, legs, and muscles. Variability. The severity and distribution of muscle weakness can vary widely among individuals with myasthenia gravis. Only affect specific muscles, which others may experience more generalized weakness that affects multiple muscle groups. Right. What is the diagnosis of myasthenia gravis? First one is neurological examination, assessing muscle strength, reflex, and condition. Electrodiagnostic test, for example, electromyography test and nerve conduction studies to evaluate nerve to muscle transmission. Endrophonium test, a short acting medication. Endrophonium, it is administered to temporarily to improve the muscle strength, aiding in diagnosis. Next one is blood test, checking specific antibodies like acetylcholine receptors antibodies or anti-musk antibodies associated with myasthenia gravis. Next, treatment of myasthenia gravis. The medical management aim to improve the muscle function and quality of life. Medications, acetylcholinesterase inhibitors, example, phyllostigmine, to improve nerve to muscle communication by increasing by level of acetylcholine. Immunosuppressive therapy, corticosteroids and immunosuppressive drugs, then azathioprine, myoprin to suppress the autoimmune disease. Thymectomy, the surgical removal of thymus gland, which is abnormal and most myasthenia gravis. Plasma. Yes, thymectomy, surgical removal of the thymus gland, which is abnormal. Many individuals with myasthenia gravis may contribute to the autoimmune process. Next, plasma exchange, to removal of antibodies from the blood plasma, particularly useful in several cases during extrabarrage. Next, prognosis. With the treatment of many people with myasthenia gravis can achieve significant improvement in muscle strength and function. The condition is typically chronic and may many require ongoing management periods, examination, and remission and occur unpredictably. Next, life cycle and support. Living with myasthenia gravis often involving adapting daily activities to conserve energy and manage symptoms effectively. Support from healthcare providers, family and support groups can crucial in coping with the challenging of this condition. The myasthenia gravis is a complex autoimmune disorder that requires careful management by healthcare professionals to specialized in neurology or neuromuscular disease. Early diagnosis and treatment can be significantly improve outcomes to quality of life and individual affect of by these conditions. Thank you.